I think, Rebecca, we can expand the view. Hmm. I think what we are all seeing is the presentation side. Maybe if we do let's see. So I can, let's give this a try. If I present, so people can actually use the whole screen and see the slides. Okay, Rebecca? Oh, there you go.
Can you see it now?
Perfect. That's it. Fantastic. So I think that we're ready. Good morning, everybody. It's 9 o'clock, and we welcome you to the Chula Vista Community Collaborative Partners meeting of November the 9th. Next slide. We have a tight agenda today. We have several updates from organizations that are partnering with us. We're also going to share some information regarding the strategic discussions that we have been having, not only with staff, but steering committee members, and the feedback that we were able to collect from partners like you via a survey we conducted in October. And we are going to tell you more about incoming activities from the family holiday support events with Thanksgiving meals, Adopt a Family, and Santa Shop, to which we are collecting donations in several ways to support the families residents in Chula Vista. We will have a lineup, very interesting lineup of partners, and a little bit, hopefully, some discussion about your activities and what the opportunity I want you to continue using is the chat box. It came up in the surveys as a very useful technique to interact, given that we are not seeing each other in person, but hopefully we will in 2022. And the next call is scheduled for December the 14th. Maybe very a quick call, just touching base, closing the year in prep for 2022. So let's get started. Next slide, please. And for those of you who are new, thank you for joining us. You can keep on clicking. There you go. We want to share the mission and vision of the values that guide the work of the collaborative and the direct service delivery we provide through 5 family resource centers. Next slide, please. I hope that if you are, is anybody being new today joining us? Oh, so we are amongst family. That's nice. And those 5 family resource centers are open even at school breaks and during holidays. We do have observe the federal holidays, but in terms of the school period, we're still open. And actually, the Rayo de Esperanza Family Resource Center has a closet that your clients can make an appointment for, and we can assist them, especially in these times when the weather is changing and they may need extra help with clothing items. Next slide, please. So what we were doing since last time we met in October, well, we had a successful drive-through with kind of the holiday topic of Halloween, El Día de los Muertos. That was on October the 23rd, in partnership with the Chula Vista Police Activities League and the Chula Vista Welfare Council. So that is very reassuring that our ongoing partners continue to support us, and we were able to collect food items that we're preparing the bags and the food boxes for distribution in Thanksgiving period, along with some gift cards for the products, the fresh fruits and vegetables and dairy products. We also in October had our monthly steering committee call, and you see there a screenshot of our members that include SBCS Corporation, formerly known as South Bay Community Services. We have, of course, the two main districts that assist us, the Chula Vista Elementary School District and the Sweetwater High. We also have representatives from the YMCA and the Family Health Centers of San Diego, and Scripps and San Diego Border AHEC, Area Health Education Center. So we are gladly receive their support, their guidance, and the provision of services that we do in our 5 family resource centers. And finally, we got started with some in-person, very limited, observing all the safety protocols that we could at the library in partnership with the Chula Vista Library. We were and of course, San Diego Futures Foundation, they provided the talent to help us with our Latino volunteers, specifically the promotoras. So the Latinas volunteers, PAC, promotoras en la comunidad, promotoras in the community.
I'm in here right now.
And we were receiving some education on digital literacy, as for all the Latinos, sometimes it is a challenge trying to incorporate all this technology and the virtual world and still communicating with loved ones. Next one, please. And in those strategic conversations we have been having, we included some of those items that some of you answered in the survey regarding what are the benefits of belonging to the collaborative, what are the true measures of what we are doing in collaboration with all of you. What are the kind of degrees and different types of partnerships and associations, and also recommendations for next steps, not only for the collaborative as a whole, but for these partners calls. So we really thank you for that input. Next slide, please. And just a brief synopsis, summary of those results from those that submitted their information on time. I was so glad to see that there was representation from many organizations. 61% of our sample, very baby small sample of 18 survey respondents, but we see that you have a broad scope at the regional level, countywide, and you do come to our Chula Vista Collaborative calls and meetings. You subscribe to receive notifications. You consider yourself a partner. You download the materials that we put up in the website, which is an item that is new. Based on the work that we have been doing during COVID and the pandemic. You also interact through the website in different forms, and most of it you see as a benefit that you have access to other service providers and that you are part of a network. So that is why I constantly emphasize, number one, the sharing of information in the chat for follow-up. So several respondents indicated that they have follow-up and established contact with some other attendees. And given this virtual format and all the restrictions, I still think that is a very good outcome. And you also gave us a little bit more on how to define partnerships and some suggestions. Before I go into any further with the last two items on the measure of partnership and suggestions, let me dwell a little bit about those perceived benefits from you. And if you didn't have the opportunity to submit them the survey, you can share with us right now any input that you may have regarding how do you see the collaborative for you in terms of participating in these calls, subscribing to the listserv, and using this opportunity to connect with others. I open the floor. Let me see in the chat, is there is comments from those? Anybody raising their hand? Let me see.
Hi, good
Oh,
morning.
Maria.
I have a
I
question. I have a
recognize that
question.
face. Tell us.
Somebody's asking something. Go ahead.
Hi, my name is Ariel de la Pena. I'm from the Rock Church, Chula Vista, and I was curious, how do you become a Chula Vista Community Collaborative Partner?
Yes,
This is
yes.
only my
So
second time on the call.
yes, certainly. Well, if you're new to this group, we welcome you with open arms. Please take advantage of that chat box and all the information I've seen being shared about who is here, what kind of services you provide. And if you go to our chulavistacc.org and the partners tab, you can self-subscribe to receive the notifications, and you can also contact us for distribution of materials, sharing incoming updates and dates of your events. And that's the lowest, like less intensive level of partnership, maximizing the use of information sharing with us. And we can have all the gamut all the way to either contracts or memoranda of understanding, so we can actually do joint initiatives. So partnership is quite a broad the term, and we have different kind of relationships with different organizations. So even starting very basic with attending the meetings, disseminating the information shared here with your clients, with your the families that you may be supporting, and also sharing with us. And therefore, everybody that joins, the updates on your activities. So that's all the way. There's a lot of in between that level of partnership. And I can,
Perfect. Thank you.
yes, certainly. I see here from part of the feedback, the very specific feedback, is that you have asked for opportunities for the new attendees, just like you just did, to share about what they're doing, and not only in the call, but afterwards, providing information on your programs. You guys in the feedback indicating that people feel comfortable in this environment, sharing the information and contacting individually other members. So that is absolute great in terms of us facilitating, not necessarily moderating or putting parameters, but actually just bringing everybody together as a hub. Um, so that is important. Many of you mentioned about the need of a meet and greet, and we understand that. And so far, we may have do the planning for next year, but for 2021, we have decided to continue with the virtual interaction. But we hear you in 2022. The work will allow to be in person again, or a mix with virtual and in person. There's a question there in the chat I see about a list of members. You can go to our Chula Vista cc.org webpage, and you see kind of a directory of the members so far. And if you don't see yourself there, let us know. Or if you need to update your contact information from our website, please do so. More comments on what it means to be a partner, what this collaborative and your membership has meant for you or your organization?
I want to chime in. This is Thomas with CWS. And I think, a big part of, I think we, as an agency, I always feel that we play a role in the community. We try to provide support for schools. We try to provide support for the family who lives here, because it's important that, family kind of get the resources and get the help that they need within their own community rather than have to travel out. A lot of the times I hear from families feedback is like, well, I wish there was something closer. I wish there was a one-stop shop. I wish there was this and that. So, I think a lot of time our families, sometimes they just don't know, and just having like, a place where they could just stop and just like, hey, there's all right here. That's why I asked for the list. I'm probably going to have a list. And if we have no people on there, we could refer them, hey, call this person, call it. It's kind of like that. It's so helpful with the families we work with, that they know that, hey, I could call somebody, and or it's just like a kind of like the yellow page, like back in the days when we had those thick yellow page books and stuff like that. So, but being a part of this, I feel, I've always felt welcome. The moment I came on, and everybody just, I just, the presentation, everything has just been a wonderful experience, and I continue to want to develop that with everybody here.
Thank you so much. And indeed, if you go to our website, you have the listing of the locations, and even in the map, hours and phone numbers of our family resource centers there. So that is available 24/7. And yes, you can send us your referrals of families. We have a welcome package kind of screening form, and we discuss the individual needs of not only individual, but of the family as a unit. And okay, I can go to the suggestions listed in the survey. So one topic that was requested to have more information about was about housing. And we know that the families we serve across the board through many organizations, I'm speaking to the choir here, we are in such a dire need to make those connections for assisting families that are transient or homeless. In fact, one of our presentations today is going to be talking about what we're doing here at the CVSD, the Chula Vista Elementary School District. But there is a need for having like a housing forum, and that is duly noted. And for the 2022 first trimester, I think that we will be able to pull something together there for many organizations. So if you're interested in partnering with us regarding the housing forum, a possible housing forum, please let me know in brendali.rodriguez@cvesd.org, or just the info, our general email address, or put your interest in the chat. Another suggestion that was put there was, in addition to the meet and greets and so forth, is even changing the time. And that is something that you can put your thoughts very quickly in the chat box, in terms of either leaving the time from 9 to 10:30 or having an afternoon setup. So just let us know very quickly so we can then tally. And because even though that it was one suggestion, we really have to go with the majority of those that continue to come and support us. So it's not that we're not listening, we just want to get a feel for what works for the majority of the attendees, okay? And I think in summary, those are the major topics on the suggestion box from the survey. So we really thank all of those that provided the input via email and through the survey. And in looking at the responses from the chat, seems like the morning works better. Yes, we can even count them, and it's just the majority would like to keep it in the morning. So I think that we have made a decision by consensus, and we're gonna keep the Chula Vista Community Collaborative calls in the morning. Thank you for that quick reply with your preference. And
Brenda Lee.
oh yes, who is here?
Good morning. This is Anna Lozano with Molina Healthcare. Pleasure to be here with you, Brenda Lee, and seeing you. Just to add to a suggestion and just feeding off what I've been hearing, another thing that I've seen done in other collaboratives that might work in this one is at the end of the meeting, giving like 10 minutes at the end to discuss particular cases. Like just in general, I know we don't want to put PHI information, things out there, but at least saying I have a family that needs these type of services, and maybe in part of the collaborative, we all have kind of like the same mission, right? We're all trying to make sure everyone's safe, everyone doesn't go hungry, everyone gets resources. So I think as a community, as a family that we are, I think we could come together and support each other, because like some people are saying this is their first meeting. I've been attending this meeting in different roles for like 10 years plus. So I know that I've really gotten like a lot of resources, been able to participate in a lot of events, brought incentives to a lot of programs because I'm able to hear the needs in the community. So I learned a lot, and I take a lot from this meeting. Sometimes I don't chime in because I want to open the floor to everyone else, but I think that just doing a little bit of troubleshooting at the end of the meeting, allowing like 10 minutes and just general questions like, I have this situation, do you know the resources? And I'm pretty sure someone's going to come up with a good resource in the community. So just my 2 cents.
Thank you, Anna. That is a very powerful suggestion. And I think that was duly noted in number one. And number two, we will kind of try to organize in a way that is kind of targeted, protective of the information that is sensitive. And we'll think of a format to kind of keep that, honor the time, but also provide an opportunity for discussion and interaction, rallying around a particular case that an organization may bring in. Okay, thank you.
Good morning. Good morning. This is Tony. Thank you, Ms. Anna. That's a great suggestion. I hope we'll be able to do that, because we do, since we work with low-income families and children, we focus on the children's well-being. That's a good idea. Thank you for that suggestion. Have a good day.
Excellent, excellent. And I know that Rebecca is taking notes. I know that my staff will be integrating this in our future discussions for 2022 and the next steps of the Chula Vista Community Collaborative. We're going to spend the next 2 months really working, well, a month and a half now, working in the holiday family support, and I will tell you more about that in a second. So as a thank you for those who filled out the survey and provided information on time, we're going to do a raffle. I have the email addresses from those that replied yes, that they would be interested in the raffle, and you will get a email from me saying yes or no, and it will be an electronic gift card. So thank you for that. Next slide, please. Here I begin with all those updates that you sent me for a quick information, and we start with even today an event, and I saw already one person that can tell us more about it, Liliana Osorio, the director of the Health Initiative of the Americas. There is a Spanish webinar put together. It's today, so there's still time to log in. It's going to be live on Facebook in Spanish about the vaccines, COVID-19 vaccines for children and adolescents. So Dr. Ian Shapiro from AltaMed is the main speaker. Liliana, are you here to tell us a tad more about it?
Good morning, Brenda Lee, and good morning, everyone. Thank you for giving me this little space here in your wonderful meeting. Yes, as probably most of you already know, that the pediatrics COVID-19 vaccine has been approved, was recently, and I am sure everybody has a lot of questions about the safety, the importance, and why, and when, and where. So we will provide this a webinar today. Dr. Ilan Chapiro is a pediatrician from Altamed. He's Mexican, and he will speak. We will be in Spanish. This is a nationwide webinar, so we expect a lot of people. You can join via Zoom, or also we will be just Facebook Live. That is our link, our address at HIA.UCB, the Health Initiative of the Americas at UC Berkeley. And really, if you have questions or you want to learn more about vaccines, COVID vaccines for children, not only 5 to 11, but also the teenagers, because it has been approved for a while from the 12 to 17. This is the opportunity. This is the moment. There's a lot of information out there, mainly in English, but this is a good opportunity to listen that in Spanish and to ask questions. That's what is called a pregúntale al doctor. Ask the doctor about any questions that you have regarding the vaccines, the COVID-19 vaccines for children and adolescents. So we hope you can join us this afternoon. We'll see you there. It will be at 3 p.m., 3 to 4 p.m.
Thank you, Liliana, for making time in your busy schedule. This is all part of the Juntos y Podemos initiative. And as the Chula Vista Community Collaborative is a member of several of these nationwide efforts to connect the dots and disseminate true information, reliable and credible information from reputable sources. We have some questions in the chat. Is there a flyer? And I think that, Liliana, you can forward those flyers if there are. I know that I have seen several electronic announcements. So there's a lot of buzz around this event today at 3.
Definitely. I will share that with you, Brenda, so you can share it with the rest of the group.
Miss
Yes.
Liliana, this is Tony. Can you read out to me the link that I only see at HIA dot, and then I can't see the rest of the letters. Can you tell me what they are?
UCB.
Oh, okay.
Or
Thank
if you go to Facebook and it's Health Initiative of the Americas, you can also find it there.
Oh, okay. Thank you so much, Miss Liliana. Have a good day.
Thank you, Tony.
This is Maria. Can you also send the link for the Zoom for those who can't do the Facebook?
Sure.
At work.
Yeah.
So Liliana, if you can quickly put the link in the chat with a cut and paste, that would be wonderful, because the chat remains active and people can just click on it and don't have to wait until we upload everything on the website and then they have to download all the flyers.
Yeah, let me, okay.
So you have the rest of the call so you can put it in with a cut and paste in the chat.
Okay, let's good find chat. Where's the chat? Okay, chat.
Yeah, and just do the cut and paste there.
Yes,
Thank you.
that is the Zoom. Yeah.
Fantastic. Thank you so much, Liliana. Next slide, please. We wish you very much success in the event today at 3.
Thank you, Brenda Lee. Take care, everyone.
We have now actually Maria with our mobile medical unit initiative here at Vista Square Elementary in the parking lot. They're going to be here on Thursday, even though that is a holiday, they're still going to be here, right, Maria? And,
yes.
and
the mobile
there's
clinic
no
will be
need for
there.
an appointment. So tell us more, Maria.
There's no appointment needed, walk-ins only. And I did send the flyer to everyone. This is the first week of service back in the community after the pandemic, so almost a year. We're very happy to come back, and we are coming to Vista Square for now. Then we'll look for more, for probably going back to the same schools that we were before at, like Feaster and other ones. But for now, this week, all day, Thursday, 8:30 to 12 and 1 to 4. No appointment needed. If there is, I can send the flyer because it has a lot of details and most of the information. And most of you already know our services, but it's basically coming to provide the services that somebody has mentioned before, bringing the services to the community instead of having the community coming to us. But I'll send the. You have the flyer, Brenda? You want to send it to the rest of the members, or should I send it? I also emailed the monthly calendar to those who would like to receive it, and thank everyone for being part of it and referring families to us. There's also a low fee for those without insurance. We don't request any proof of income or residence. Everybody is welcome. We accept most insurance plans, so everyone is welcome. And the number will be, it's there, so you can reach out with more for more information to Rosa Ramirez at the 619-515-2312. But I can send the flyer to everyone, or to Brenda, that way she can.
And if you can type it up, Maria, the number in the chat, it's always good with numbers to have them in the chat. And we have on the screen your email address so people can actually contact you later. And just to wrap up that announcement, you guys also have a position as a health navigator, and that's the ID number there and the website to link it. Remember that all these links are live in the PDF that we upload from this presentation, so you can click on it as well.
Yes, that health. What's it called now? It's a new health navigator. It's for housing. So we have a grant that we house families, individuals who are homeless or in risk of becoming homeless, and thus the person will need someone to help with that. Our area to cover is south and east. Natural Vista National City, but more south, Imperial Beach and Coronado and more. But there's all the organizations that cover the rest of the areas. But that would be a great to have somebody joining our team.
Thank you, Maria. Thank you for your ongoing support. Next slide, please. We have several more updates, and this is from the script in Border San Diego AHEC. We have the whole month there of activities, and that includes a variety of topics of support groups in Spanish for several conditions and diseases. So again, you will receive, you can download the slides and the flyers later in the week from our website, chulavistacc.org, and the Partners tab. Next slide, please. And we have from our friends in San Diego GE on November the 10th, which is tomorrow, from 4 to 6 p.m., we're going to support them in an event to assist the residents to apply for help paying the past due rent and utility bills. So 2 of my staff are going to be there in support of Marta Quintero and her community outreach efforts. The address is right there, and the South Bay Recreation Center. So that's tomorrow from 4 to 6. And the help will be able to be done at the one-on-one level and in Spanish, as 2 of my staff will join the corps there in support of SDGE. Next slide, please. Oh, I see a question there, Mario. The flyer in Spanish, yes, the flyer is in Spanish, and we have distributed that among our FRCs. We will send that again for all the FRC staff. Another update is a free opportunity for training from Aging and Independent Services and HHSA and the county. And it begins late November, but it runs until the December the 8th. And attendance is required all 4 days. There is an opportunity for stipends. And Nicole might be here. I hear somebody talking, so if it's not Nicole, if you could put yourself on mute to avoid the background. And Nicole, are you here to tell us a little bit more about this training?
Yes, I am. Thank you for having me. Good morning, everybody. I'm Nicole from the County of San Diego. We provide these healthier living workshops throughout San Diego County. We have the option to provide them either in person or virtually. And right now, we're really recruiting for trainers. So if anybody's interested in becoming a healthier living leader, we will be hosting the free 4-day training. It is from 9 to 4:30, so it is a commitment. But if you're interested, feel free to reach out to me. My contact information is included on this slide, and I'd be happy to respond to any questions you might have.
Any questions from Nicole? Now that we have her here, and if not, you're always welcome to give her a call or email. Thank you, Nicole, for stopping by and sharing with us this opportunity for training. Next slide, please, Rebecca. And we have our next update here about a virtual real world panel. And this is going to happen on November 17. And it's an interesting program with having a speaker on that day. It's virtual, and you have to register online. The links are going to be live, so you can just click in there for registration. And is anybody from that program here with us today, so you can add a little bit more info to it?
That would be me. Can we hear me?
Yes.
Okay. Hello, Brenda Lee. Thank you so much. Thank you so much, Chula Vista Collaborative Partners. My name is Paula Ammons, and I'm the CASA Outreach Coordinator for Voices for Children. And so we train support quarter point special advocates, also known as CASAs. And so this panel will feature some of our real world youth who have either been involved with the foster care system or are currently involved, and they share their experiences about their time in care. And so we like to anchor our work in stories. And so that's what the CASA really is a storyteller where they advocate for their youth's best interest. And so this is one of our achievements. We're incredibly proud of our youth, and we're incredibly proud of this panel. And so if anyone is interested in just learning more, I know we have partners on here who already work in the child welfare system. And this is a wonderful way to just hear about those stories directly from the youth that we provide services for. And so if you're interested, I'll go ahead and put my information in the chat again. And you can email me, and I can email you some of those flyers. And we also have a social media graphic as well to share out. So yeah, thanks so much, and hope to see you all there.
Thank you for sharing this opportunity. Next slide, please. Another support from Scripps to us, in particular, and our Latina volunteers, older Latinas, is the Senior Health Chats en Español. So we have one on November 19 at 9 a.m. It's a small group. We already have a few that have accepted the invitation. So please, let's work with Azucena Lopez de Nava, our coordinator for the Promotoras de Salud, if you're interested in attending this session, or your clients, in Spanish virtual mode. And this particular topic will be about the healthy gut health, and is targeted again to seniors. So that we appreciate the partnership with Scripps. Next slide, please. From the Chula Vista Elementary School District, we have December the 4th, Saturday morning event. It's called the Parent Academy, virtual still, and there will be Spanish interpretation available. You have to register in advance, and you can go to www.beautifychulavista.org and connect with the CVESD Parent Academy. Next slide. The holiday support. So here we go. This is a time of year that we knock on doors and welcome donations for support to our Chula Vista families. We prepared a very nice pictorial summary for you. The link is there, and you can see all those faces with masks, but very expressive eyes about our staff collecting and distributing assistance. And this year new is going to be collecting loaded Pronto Metro cards. As you know, the system changed and now is via a plastic little card or a app that you download, but those need to be loaded up with funds, right? And we do need some day passes, equivalent about $6 for a day pass, and plus the $2 of the actual card. And also we provide monthly passes of $72 an adult, or $23 if it's a youth or a senior. So we do need those loaded Pronto cards as well to provide support to our families to get to school, to get to their therapy sessions, to go to work, to go to purchase their food items or hygiene, cleaning supplies. We're putting up baskets together this morning here, my staff, with cleaning and hygiene products that we have been requested by some of our families that we serve. So yes, gift cards now is kind of the method. It's easier and less touchy. So we welcome those from Walmart or Northgate. Those are kind of where the dollar stretches more, right? And with the Santa Shop, we not only like toys for boys and girls and gift cards for teenagers, but also like painting and drawing supplies and kind of anything that is kind of hobby oriented, and assist them with those inquisitive minds. And the Adopt a Family program, we are putting together some profiles of families that if your organization would like to sponsor a whole family with the different kind of specific needs, you will be rewarded in many ways by providing very targeted support to a particular family through our Adopt a Family program. Next slide, please. And now I know that we have done a lot of updates because this is a time of year that we all are busy. I wanted to honor that commitment for the sharing of information and updates from partners. And now we have our lineup of speakers. And I want to touch base with Adrienne if she was able to join us for the COVID vaccination for children updates.
Hello, everyone. Thank you very much for having me. So I am Adriana Burst, and I am a manager in the Research and Health Promotion Department with San Ysidro Health, and I am going to provide a few updates regarding COVID vaccination for children. So I don't know if it's possible for me to be able to share my screen during the presentation to share some of those updates.
So yes, so Rebecca just has to get out and allow your permission, and you go in.
Okay. Great.
You have 15 minutes starting now. And there you are.
Wonderful. Okay. So I am going ahead and sharing my screen here. Hopefully you all can see momentarily.
There you go. We're ready.
Excellent. So as I mentioned, I'm a manager in the Research and Health Promotion Department with San Ysidro Health, and just going to share some updates about the COVID vaccine for children. So to start, who we are at San Ysidro Health, we are for those of you who are not familiar with us, we are a federally qualified health center. We're located primarily in the South region, in the South Bay region, but we also have some locations expanding into East County, North County, and more central San Diego. So we have, at this point, I think around 40 or so different clinical sites or clinic locations, and we provide a lot of different services ranging from, primary care, patient care, medical services, behavioral health, dental, and also a lot of different support services such as outreach, nutrition, health education, social work, family support, etc. Okay, so I'm going to get started with a little bit of information on how does COVID-19 actually affect our children. So we need to think about this to understand, why is it important, the idea of vaccination. So there's definitely a myth that we have heard that children can't get COVID-19. That is something that we have heard from certain people in the community and unfortunately is false. So we do know that there are fewer cases of COVID-19 in children under 18 compared to adults. However, children still can get sick from COVID-19 and they can still spread the virus to others. Some children might develop a severe illness, especially those with underlying conditions such as asthma or obesity or other conditions like diabetes, etc., might be more at risk. And then we also know that pediatric cases are increasing, in particular in the last few months, with the Delta variant being highly contagious. We've seen a lot of increases in cases and also more severe cases with the Delta variant. So if we look at the data, according to the Centers for Disease Control, there have been about 6.5 million cases in children under 18 through the end of this past month. And then if we look at cases in children specifically age 5 to 11, which is that newly approved vaccination age group, there have been almost 2 million COVID cases and 143 COVID-related deaths in this age group. There have also been about 8,000 to 9,000 COVID-related hospitalizations in children age 5 to 11, looking up until about a month ago. And COVID-19 has actually risen to be one of the top 10 leading causes of death for children ages 5 to 14 between, in the earlier part of this year. And a lot of that is with the variants being more spread. We also know that in the community that we live in, so thinking of San Diego County in particular, there have been about 25,000 cases of COVID in children ages 0 to 9, and about 44,000 in ages 10 to 19. So it is also affecting us here in San Diego County. So what do we do about this, right? So this is, the kind of principle of the vaccines in general for COVID-19 is, first we identify, something like, COVID-19, and then the next steps are really for scientists, experts in public health to work together to conduct research studies, clinical trials, and learn how we can help detain this impact of the pandemic. So part of that is all the precautions that we've known of, the masking, social distancing, testing, avoiding, big groups. And part of that is also the vaccine. And, it does take a little bit of time to kind of go through the process of getting to the point where we could have a vaccine. But now we are at that point for the for adults, for adolescents, and now also for the children age 5 to 11. So knowing a little bit about how vaccines work, the vaccine for the children age 5 to 11 is going to work very similarly to other vaccines, for children and the COVID vaccines that we have for adults. Basically, the way it works is it works with your body to build immunity to a disease. And we know that over the years, there have been many, many times where vaccinations for children in particular, with certain things like, measles, smallpox, polio, hepatitis, have saved millions and millions of lives. And the other important thing about vaccines in general is they don't only help the person who gets the vaccine. Once enough people get vaccinated, they help protect the community as a whole by helping stop the spread of the disease and protect people at risk. So we know already that as of a little while back, we had already gotten authorization for the Pfizer vaccine specifically for children ages 12 to 17. So a little bit of a recap for this. It's basically very much the same as the vaccine that Pfizer has for adults. It's 2 doses, 21 days apart, and it's given in the upper arm. And it showed great data in terms of effectiveness for adolescents, similar to the vaccine for adults ages 18 and older. And now the new piece of news that we have is the Pfizer vaccine being approved for children in the age group 5 to 11. So a little bit more information on what this means and how it's different and how it's the same. So it's basically the Pfizer vaccine only. So we know there's also the Moderna and the Johnson & Johnson that exist, but those are not approved at this point for anyone younger than the 18-year-old adult age group. So Pfizer is the one that's for children. It's 2 doses, 21 days apart, similar to how it is for adolescents and adults. The difference is for children is it is a smaller dose of the vaccine. So compared to what adults would receive, children are going to be receiving 1/3 of that quantity of the vaccine. It's administered with a smaller needle for children, and it's also really should be based on the child's age on the day of first vaccination. So there's that 1 dose for all children age 5 to 11, and then if the child is ages 12 and older, then they get the other dose that's the full dose that's for the 12 and older age group. One question that we've gotten is, what if your child is around 11 or almost 12? What should they do? So the recommendation that we've heard based on experts is that if the child should receive that dose based on their age on the first day of vaccination. So if they're 11, then they would get the version of the dose that is recommended for the 5 to 11 age group, and that they wouldn't need to get the one for the 12. And we recommend really that the child would get vaccinated sooner, as opposed to necessarily waiting. If you're going to say, oh, well, my child's 11 or they're 10, so I'll just wait another year or so for them to turn 12. Really, the recommendation is to go ahead and get them vaccinated and not necessarily waiting. So the critical question, is the COVID-19 vaccine safe and effective for my child? So like all vaccines, including the other COVID vaccines, the ones that are available for children have been rigorously studied through multiple phases of clinical research studies, reviewed by public health experts and scientists. Part of the reason why the vaccine for children was not approved at the same time as it was for adults is because it needed to go through all these additional, kind of review processes and, starting with the adults and then moving into children that are obviously a much more a sensitive group to be considering. So scientists conducted a clinical trial with about 3,000 children, and based on reviewing all of the information from that trial, this was gone through multiple different committees at the Food and Drug Administration, the FDA, the CDC, and now it's finally been approved by all the various, expert committees to that it meets the safety and efficacy standards to authorize it moving forward. So the FDA approval process, I won't get into the details, but it's basically a lot of different processes that happen where the FDA will review a lot of different aspects about the safety, effectiveness, a lot of very strict standards before approving any sort of vaccine. So this same process happened with the COVID vaccines we have now for adults and also the one for children. One question that we get is about side effects. So one thing to keep in mind is similar to adults, it is expected and kind of a normal sign of your bodybuilding protection to have some mild side effects such as pain or soreness, swelling in your arm, or maybe tiredness, headache in your body, usually about 1 or 2 days after getting the vaccine. We have seen so far that children may experience fewer side effects compared to adolescents or adults. One thing that we've gotten some questions about in particular is people have heard some kind of rumors or information that getting the COVID vaccine is going to give their kid myocarditis, which is something that is inflammation of the heart muscle. So an important thing that we wanted to note about that is in the clinical trials with adolescents and young adults, there were a small number of myocarditis cases that were seen after COVID vaccination, mostly in younger males, like kind of that young adult male age group. However, it was a very minimal number of cases, and most of those cases got better on their own or with just a minimal sort of medication. So this was something that the scientists were looking for when they were doing the vaccine trials with children, because they had seen a handful of cases in those young adults. So they just wanted to make sure and learn more about that, evaluate that appropriately with the children. So in the clinical trials that happened with the children, ages 5 to 11, there were no actual reports of myocarditis from the vaccine. So that is just an important note to mention. And another important thing is that the risk of getting myocarditis from actually having a case of COVID is actually much higher than the risk of getting myocarditis from a vaccine in this small number of cases. So that is just an important point regarding that question.
4 more minutes.
Sure. How effective is the COVID vaccine for my child? So we know that the immune response for children ages 5 to 11 is very comparable to those for adolescents and adults. The vaccine was basically found to be about 91% effective in this age group, which is great. Similar with the vaccine for adults, it takes about 2 weeks after your second dose to really have that protection. And even if your child had COVID, it doesn't mean that they're immune. They still should get the vaccine. They just shouldn't get it while they're having active symptoms. And of course, for younger children, age 2 to 4, and anyone else who's unvaccinated, whether children or adults, it's important and recommended to continue to wear masks in public spaces and with people you don't live with. Another recommendation is if your child does have any sort of chronic condition, it is still recommended that they get the COVID vaccine because, as I mentioned earlier in the presentation, people in those groups, including children, can be more at risk for having a more severe version of COVID if they do get COVID. So it's even more recommended for this group to get the vaccine. The benefits of getting the COVID vaccine is basically that there's no real way to know how COVID will affect you, especially with more contagious variants that are, in the community now. Really being able to get that vaccine is important to helping add that additional level of protection for you, for your children, for your family, and give that peace of mind for your family, knowing that you are protected from any serious complications and you're protecting other people around you who may be more vulnerable to those types of complications. There are a few different resources for talking to your child about COVID vaccination. One that we would definitely recommend is St. Jude's has come up with a COVID-19 vaccines coloring book. I've only seen it in English at this point. I'm not sure if they're working on it in other languages, but it basically has a lot of, kind of very simple wording for children to be able to, learn about the COVID vaccine. So, for example, it's talking about, your immune system is like a team of superheroes that can help protect you. And it just explains to children a little bit about the vaccine and kind of is fun and interactive, has some coloring books, some little puzzles and things like that. So this is a great resource. We can, send you the link, or also I'll put it in the chat afterwards, or you can just Google St. Jude's COVID vaccine coloring book. And then lastly, getting a COVID vaccine, how can you get one? So basically, now that the vaccine is available for ages 5 to 11, different organizations are starting to offer the COVID vaccine. So there's the same resources that you would have for getting the vaccine for adults. That includes the county, various pharmacies, grocery stores, or your primary care provider. There are also a lot of different various events or locations in the community that you can find, some of them via the county website or other local organizations where the vaccine is being offered. Our recommendation is that, it's taking a little bit of time for different organizations to be able to get everything together, to be able to have everything set up to offer the vaccine for this 5 to 11 age group. So if you're going somewhere to get the vaccine for your child, we just recommend checking with that specific location first, even if they're providing it for adults, just to make sure that they're also have started including children, since this is all very new information. So that's that's pretty much it. I think I'm right at my 15 minutes here. So if anyone has any questions, I don't know if we have a moment to take any of that, or I'm happy to answer them in the chat as well.
Yes, thank you so much, Adriana, also for answering my call about, oh, we need to speak about this, given that right now we are fielding questions from not only family members, but our clients and others we serve. Do we have one burning question that Adriana can answer right away? I also saw that, Adrian, you touch upon several questions that we already have on our mind about safety, about the dosage. Are they same or not? And they're like 1/3 of those of adults. So thank you for anticipating those questions from the audience. And again, if you send me those slides, Adriana, I can include that in the package that we will be uploading later in the week.
Sure, no problem. And I actually did just send them over to you, Brenda Lee. So happy to, have those shared with everyone. And I'm going to put in the chat right now the link to that St. Jude's coloring book resource that I mentioned. Thank you very much for the opportunity.
Thank you so much. I have seen El Sol Neighborhood Center from Los Angeles having a kind of fotonovela with also like the hero theme for the kids. And I see one chat, one hand up. Let me see who's that. Michelle Darnell. Michelle, do you have a question?
No, I just have a comment. So Medical Center Pharmacy is vaccinating and will do it for children as well as adults for the boosters. We have been running events, going to places. So if there is a group of people that can't get out, you can always reach out to me. And I think Romy's on this phone as call as well. You can reach out to her as well. And we'll be more than happy to come to you instead of you having to come to the pharmacy.
That's very good. Please share in the chat that information so people can immediately contact you for follow-ups. And now we have our next speaker, the South Bay Youth for Change project from Lisette Munoz. And I'll ask Rebecca if you can pull up the slides they sent us, the PDF, for the South Bay Youth for Change project. Do we have Lisette on the line?
Hi, Brenda Lee. Yeah, I'm here.
Fantastic. Let's see if Rebecca is there. If not, I will then take over and pull up your slide. Let me just do that.
Okay, sounds good.
Share content. Do you see it? The South Bay Youth for Change.
Yeah. So good morning, everyone. My name is Lisette Munoz. I'm here to give you some information on South Bay Youth for Change, which is a youth group that works to improve the health and safety of our communities by preventing underage alcohol and substance use and the problems that they create. I'll touch on some details about the group, some of the awesome work that has been done in the past years, and how the youth in your life can get involved in our communities. So I am the youth advisor for South Bay Youth for Change. I work for the Institute for Public Strategies as a youth and community organizer for IPS South Bay and for the Partnerships for Success project. This youth group is something that I'm very excited to share with you all because just like the students that I work with, I grew up in South Bay. I was enrolled in Sweetwater Union High School District from preschool all the way to senior year of 12th grade. So I wanted to begin with a quick icebreaker. So I have a riddle for you all. I know we have a time constraint, so maybe we can keep it under a minute. In the chat, I don't know if you want to type it in, but how can you go 10 days without sleep? Does anyone have an answer? Let me see. Let me look in the chat. Does anyone have a guess, or you can't with lots of caffeine?
A lot of.
So the answer is actually because you sleep at night, you don't sleep in the daytime. So it's kind of like a riddle, kind of outside the box. Yeah, thank you all for participating. So if we can go on to the next slide, please. So South Bay Youth for Change is a group of young advocates throughout the South Bay region of San Diego, whose goal is to prevent underage drinking and drug use in their communities. Alongside the community service work that they do, this youth group offers a wide range of valuable opportunities, such as supporting populations that are in need by performing community service, acting as spokespersons at media events, working alongside city officials and law enforcement, writing news releases and letters to the editor, performing external assessments of stores that sell alcohol, attending state and local hearings, gathering data to identify problems, and create policy solutions related to underage drinking and substance use within the South region of San Diego. They've also had opportunities to do decoy operations with police to address underage drinking and alcohol sales to minors. They also participate in youth group conferences and summits, such as Friday Night Live's High School Leadership Summit and their Youth Development Institute. We're hoping that in the future or the near future that students will be able to have opportunities to speak at city council meetings and press conferences as well, along with giving presentations to other youth groups about the coalition and all the work that we do in South Bay. Next slide, please. So South Bay Youth for Change is a key part of the South Bay Community Change Project. And what that project consists of is community-based work to improve the health and safety of South Bay San Diego residents. So this youth group is a very important part in the community work that we do, because uplifting this next generation of leaders is what will allow our communities to improve and thrive sustainably. South Bay Youth for Change fosters a very supportive atmosphere where our youth are the active participants in making the changes that they think need to happen in our communities. Next slide, please. So the ACT model is an upstream approach that addresses the underlying conditions that create problems within our communities. And in order for community transformation to be sustainable, it relies on these 5 key components to explore and implement long-term solutions. So in order for our communities to be healthy and safe long-term, we need to address the barriers that we're facing. So some of the examples that barriers that we face are housing insecurity, poverty, mental illness, addiction, limited access to healthy food options, fewer green spaces, unsafe parks, and the list goes on. So this is just the framework that we like to emphasize with the youth, because it is the framework that we use within our South Bay Community Change Project and throughout IPS. Next slide, please. So one of our recent community service events that we held, I think it was October, was the Envision Broadway graffiti and trash cleanup. And next slide, please. Here are some, here's another picture from the graffiti and trash cleanup with council members John McCann and Joe Galvez, who are the District 1 and District 2 council members for Chula Vista. At this event, we actually had 37 volunteers, and we were able to assemble 5 teams to work in different areas throughout Broadway, where business owners expressed their concern and that they were struggling with trash and cleaning up graffiti nearly every week. This next slide is actually a great example of advocacy work that South Bay Youth for Change has done in the past. The youth went to Plaza Bonita Mall during Halloween weekend to inform the public about the social host ordinance in National City. So the social host ordinance, which is also referred to as the obligations of a social host, state that all hosts of a party must confirm the age of guests, control access to alcohol or other substances on the property, and prevent anyone from under 21 from consuming any alcohol or substances. And next slide, please. During this time, National Cities Council had rejected amendments that were made to strengthen the social host ordinance. And thanks to the work of our youth in South Bay Youth for Change and the National City community, the social host ordinance was amended. And youth in the past have also amended the social host ordinance in Imperial Beach as well. So those are two big achievements for our youth in the past. Next slide, please. Okay, never mind. Perfect slide. Weekly meetings. Here are our youth conducting their weekly meeting. Members of South Bay Youth for Change have unlimited opportunities to build valuable skills, such as leading weekly coalition meetings, public speaking, collaborating on projects, organizing community service events, voicing policy concerns to city officials, and more. Next slide, please. This was actually at the Chula Vista Candidates Forum in 2018, where students addressed local city officials and candidates with youth-related concerns by serving on a panel. And one student was actually able to voice his struggle about taking so many different buses just for him to get to school. These were all students from High Tech High. And I think we're, okay, next slide, please. So the students prepared their questions and talking points with IPS at their Speak Well training and media advocacy training. Next slide, please. And that is them getting prepared with some of my coworkers. And this is actually something that came up today, I believe, earlier in the meeting. So this was the youth participating in the Chula Vista Welfare Council annual food drive. I believe they helped unload the food. This is all the donations that were received. They helped organize it and distribute it to the families that were in need during the holiday season. Next slide. One specific member of South Bay Youth for Change was actually recognized at the San Diego Alcohol Policy Panel for his leadership and advocacy work to inform students of the public health and safety impacts of alcohol. Next slide, please. This is our Live to Celebrate Tomorrow 2019, which was organized by Sweetwater Union High School students, or Sweetwater High School students, I'm sorry. So this was an event that they hosted. They had very special guests such as the mayor of National City, a city council member, and the captain of the National City Police Department. One other program that South Bay Youth for Change youth have been a part of is the Juvenile Drug Smuggling Prevention Program, which was implemented to address the rising instances of youth crossing over with drugs or other substances for cartel members. There was a high number of students within the San Ysidro High School area that were recruiting their friends, recruiting other students. And so this was a big way to address that issue. Yeah, so this is also another opportunity for our youth to work alongside law enforcement. They were able to partner with the Sheriff's Department and IB at checkpoints in Imperial Beach. They were able to educate the public on DUI facts that were not only specific to our communities, but national statistics, and they were able to hand out informational pamphlets. Next slide. And as I mentioned earlier, one very special thing about our youth group is our partnership with Friday Night Live. South Bay Youth for Change kids have had the chance to attend their Youth Development Institute in 2019 and also in 2020. And while they were there, they learned skills on advocacy, public speaking, and how to encourage their peers to develop safe and healthy habits long term. Next slide, please. This is them in 2020. The Friday Night Live Leadership Summit, fall 2019. I actually had one of our South Bay Youth for Change members participate this year. And since it was all virtual, they were able to get the option to have a pizza box sent to their house. And they had a pizza party through Zoom. So that was really cool. And so this final slide is something I wanted to share. It's another act of community service, and giving back to the populations that need that extra compassion and support is an invaluable experience for our youth. Our group offers opportunities for them to be involved in many different ways. So we really pride ourselves on creating this supportive atmosphere for them to feel free to go for the endeavors, whatever, if it's personal, professional, community based. We really try to support them in whatever they want to go for. And next slide. So feel free to pass the word along to any youth in your life. I've added QR codes for a Google form to sign up, also how to connect with us on our Instagram, Facebook, and my email as well. Thank you everyone for your time and participation, and I really look forward to being a part of the Chula Vista Collaborative team.
Thank you, Lisette, for all that information. And I know the visuals were very powerful, and hopefully there will be more follow-ups from attendees from this call today. Sharing your information in the chat. We already have a request from Ronnie. So Lisette, please type it, your slide, from your slide, your email address and other relevant contact info, Lisette. Thank you for joining us.
Thank you so much.
And we have our next speaker. Let me see. We have the redistricting. Oh my gosh, I can't pronounce in English the presentation from the California Citizens Redistricting Commission. We draw the lines, California.org. And do we have the speaker?
Yes, I'm here, Brenda Lee. Yeah, believe me, I get that mixed. I can't pronounce that also, so don't feel too bad.
So take it away. Your 15 minutes begins now.
Thank you, Brenda Lee. Hello, everyone. My name is Andrew Amaral. I'm with the California Citizens Redistricting Commission. I'm the Southern California Field Team Lead in our region. I'm also responsible for Imperial, San Bernardino, and Riverside counties. So just as a reminder, on slide 2, we cannot take any questions, or excuse me, I should take that back. We cannot take any public input, any of the commissioners or staff outside of a public hearing. I can answer any basic questions, but if you'd like, you could also send me questions as well. I will be more than happy to answer them. And if I don't have the answer, I will certainly find the answer for you. If it is in regards to public input, I do encourage this group and the communities that you serve to visit our website at wedrawthelineca.org. Oh, Isabel sent the full presentation. You can skip that slide because I know I only have 15 minutes. And that one too. So just to get the gist of this, the California Citizens Redistricting Commission is responsible for the congressional seats. It's responsible for state assembly, state senate, and the Board of Equalization. We certainly have gotten public input for other commissions, and what we do is we then send that over to the commission that's responsible for that particular district. So as many of you all are, or might be already involved in this too, you might be involved with the County of San Diego, you might be also involved with the city of Chula Vista. So, you know, we do deal with a lot of these commissions already. Like I certainly have been in communication with some of the local commissions, but certainly, you know, that's what we're responsible for. If you have any comment or questions or feedback in regards to anything statewide, we would be the particular commission to come to. We do encourage you to also get involved with the other commissions that are also within your district too. I understand, like, you know, it's asking a lot because we all have our own different ways in collecting information. But, you know, this is a part of our democracy, and this only happens once a decade, just like the census. And so we definitely encourage community members to get involved, to make their voices heard. So then that way the commissioners have the guidance and the information that they need to ensure that the districts are fair and representative. Next slide, please. So all commissions will abide by the first two. So this is our line drawing criteria. So because of the U.S. Constitution, first and foremost, the districts must be of equal population to comply with the U.S. Constitution. Number two is the Voting Rights Act. So districts must comply with the Voting Rights Act to ensure that that minorities have an equal opportunity in electing representatives. The other one, the other four is kind of based. It's up to the discretion depending on the state. So you may see different variations of this criteria, but for the purposes for the commission, number three is contiguity. So districts must be drawn so that all parts of the districts are connected to each other. Number four is communities of interest, and I'll get more into that in a little bit, but districts must minimize the division of cities, counties, neighborhoods, and communities of interest to the extent possible. Number five, districts must be geographically compact so that nearby areas of population are not bypassed for more distant population. This requirement refers to density, not necessarily shape. And then the last criteria that we must follow is the nesting of districts. So where practical, each Senate district should be comprised of 2 complete and adjacent assembly districts, and Board of Equalization districts shall be comprised of 10 and complete and adjacent Senate districts. And communities of interest, you know, this is a pretty broad definition, but according to the California Constitution, a community of interest is a concentrated population which shares common social economic interests, and that should be included within a single district for the purposes of its effective and fair representation. So that could be, you know, possibly if you're a healthcare center, that could be your clients, right? That could be also your stakeholders. We've heard testimony from San Diego County about communities in East County, you know, that also feel like they have a lot of things in common. If it's wildfires, if it's lack of access to broadband internet, that could be a community of interest. And then we've heard from also coastal cities, right, where, you know, they may be feeling the environmental impacts of all the issues that are related to the ocean. I think recently there was an oil spill in South Orange County and northern San Diego County. So certainly that can be a community of interest. And so what the commission is essentially looking for is that information, but then also too, where you feel like are the recommended boundaries. Obviously, the commissioners are all from different parts of the state. They're not too familiar with our particular area. And so it's the public's responsibility to provide that information to the commission. So then that way they can make sound decisions. And so we do have 3 online tools that we provide to Californians. The first one on your left is the Draw My Community tool. So if you've used any type of mapping software, you know, even something like as Apple Maps or Google Maps, it essentially functions the same way. It does ask a few questions about your communities of interest, and then it allows you the opportunity then to also select those areas of where your communities of interest are, and then submit that to the commission to be considered as they're redrawing the districts. The second one is the Draw My California Districts. So for those who may have, who may be more tech savvy, who may be more interested in actually drawing particular districts, that's the tool that you would want to use. This also has information that was collected from the 2020 census. And then for those who may be working with shape files, we have the Draw My California the plugin for, that's open source for GIS platforms. This is a free program that the commission is providing for those who are interested in doing that type of work. So really great tools, really great support, as you can see on the next slide. We we really pride ourselves on providing as much assistance to community members as possible. We do that in a variety of ways. They could be tutorials. You can chat with the staff that actually have developed this tool. You can email us. You can call us. And then we're so fortunate, as you see on the next slide, San Diego County does have one of the 6 redistricting access centers. It's located in Mission Valley in San Diego, but you could essentially set an appointment, go meet that staff member in person. They have computers there, or if you're uncomfortable meeting them in person, they're more than happy to set up a virtual appointment as well. But you know, they're there to assist community members. They're there to help them submit their public input and feedback, and hopefully, you know, that can be a resource to you all, as well as all the communities that you serve. And then we still have the old school ways in providing input. You're more than welcome to mail us. We've certainly gotten some really creative public input and comments and feedback. You know, an organization in the Inland Empire sent us video testimony and then included a narrative of their boundaries. So we've seen some really creative ways in you know, that community members and organizations have collected this information and that have sent it to the commission. You can also email that as well. We have a way to submit feedback too on our website. And something I want to highlight below, just because I'm currently staffing as I'm doing this presentation, the commission is meeting next door actually and having their meetings. They're going over visualizations right now. So those are essentially what if maps, you know, all throughout the state about the different possibilities of districts that they could be preparing in anticipation for the release of the preliminary draft maps. And so we do have a feedback tool there on the very bottom. We encourage community members to use the feedback tool. The maps are posted on our website. So certainly you have the opportunity to chime in as well. You can also call into the meeting. That usually happens towards the end of the day, but you know, but I also don't want community members to be spending all this time on the phone waiting to be called on. It's much easier to provide that information through our feedback tool. And really the easiest thing that this group could do if you're interested in this process is to help us spread the word. We have social media handles on Facebook, on Instagram, on Twitter. You know, follow us, subscribe, share that information, you know, sign up for our mailing list. You know, something that I'll share now, you know, because I know the next slide is the timeline, is that the commission is hoping to release the preliminary draft maps by this Wednesday, November 10th. We are mandated to release that information no later than November 15th, but we do understand that the Thanksgiving holiday is coming up, and so the commission is trying their best to release that information early. So then that way the 2-week public comment period doesn't overlap the Thanksgiving holiday weekend. And if you go further down on the bottom of the timeline, the commission is mandated to submit their final maps to the Secretary of State no later than December 27th. You know, we had tried, for those who follow us, we had tried to ask for clarity from the California Supreme Court if there was a way to extend that deadline into mid-January. Unfortunately, that didn't happen, and so now we must submit that information to the Secretary of State by December 27th. There will be other opportunities to provide feedback to the commission even after the 14-day public input period after the release of the draft maps. So certainly, please submit your comments, submit your feedback, because the commissioners, that's what they base their decisions on, is information from the community. We want this process to be as inclusive, as accessible, as easy as possible for all Californians to participate. And so,
3 more minutes.
If you have any, yeah, if you have any questions, if you have any, if there's anything that you need, or even if you want to just call me and just kind of learn more about the redistricting process, that's the wrong information, but I will post the right information of my contact information in our chat. Feel free to reach out to me. This is what I'm here for. I'm a researcher to the community. I'm a resident of San Diego County. I live in Chula Vista. So I certainly have a huge stake in this too. My children go to school in this area. So certainly we are very invested in this, both on a professional level, but also on a personal level. So I'll end there. If folks have any questions and any basic questions, please let me know. But thank you so much again for this time.
Thank you so much. I know that it's a topic that you have to kind of make the statement about how relevant it is. So Andrew, we sincerely appreciate the outreach to our collaborative here in Chula Vista. And as we have said from the feedback from partners, it does have a broader reach, San Diego County-wide. So thank you for this opportunity to learn more about the redistricting efforts.
You got it, Brenda. Thank you again. Thank you, everyone.
Bye, thank you. And our last but not least speaker is homegrown from the CVSD district, the social work program supporting the McKinney-Vento youth. And we have, hopefully we have Leticia or Tanya today, social workers from the Chula Vista Elementary School District. And we have 15 minutes, and I urge those that have a particular interest to stay with us a little bit more today. Remember that all these presentations and flyers will be uploaded along with the recording of the call. Leticia, Tanya?
Thank you, Brenda Lee. Thanks, everyone. We're so excited to be here with you all, and we know we only have 15 minutes, so we'll get to it. My name is Leti Enriquez, and I am here with my colleague, Tanya Moreno, and we are here to talk to you today about the work that we're doing with students whose families are struggling with housing. We're going to give you some background information on the work that we're doing, and we'd like to really invite you to contact us if you find yourself working with a family whose child attends our school district and meets the federal homeless definition that Tanya will share with you in a moment. But before we go into details of the support services that we provide, I'd like to give you some background information about our program and our school district. So here you see the map. We're the largest elementary school district in California with 49 schools and approximately 30,000 students. So if you didn't know, we're pretty big. And this map here shows you the area that we cover. And as you can see, we cover a good portion of the South Bay. And at the district level, we have 8 district social workers supporting the social and emotional needs of students in foster care and our McKinney-Vento students. So we'll learn more. This is what today's presentation is all about. So what are the demographics of our students lacking secure and stable housing? Well, according to our state data, 74% of students are Latino. And this is an overwhelming majority. And just to give you some context, Latinos make up about 39% of the population in our state. But, you know, it's a huge overrepresentation that are facing homelessness. And you might also be asking, well, how many students are we talking about? Well, in 2018, the schools in California reported 207,677 students. So although this number seems high, experts actually tell us this is likely a pretty significant undercount. And one of the major concerns right now is that schools across the state have seen a drop in the identified students facing homelessness. So you'll see here in 2020, 2021, we had the lowest number reported. And unfortunately, it's not because our families are struggling or not struggling economically. We know it's actually the opposite. Many of our students have disengaged during distance learning. We saw our number of enrolled students really drop, and specifically with our McKinney-Vento youth, our list was really cut down a half, which is, you know, we did some work to try to reach out and identify, but this is still an ongoing struggle and part of the reason why we're here presenting to you today. So, yes, thank you. So Tanya's going to talk to you a little bit more about our McKinney-Vento federal definition and what we're doing in the district to support the kids.
Good morning, everyone. So oftentimes people's traditional understanding of homelessness is individuals who are unsheltered and maybe staying in places such as cars, parks, public spaces, bus stations, or any other similar settings. The federal definition of homelessness, however, is individuals who lack a fixed, regular, and adequate nighttime residence. So that's a lot more broad, and that's meant to cast a wide net of individuals and families, not just those who are unsheltered and meet maybe that traditional definition of homelessness. For example, we also have individuals and families who may be living in shelters and transitional housing, and that can include domestic violence shelters, youth shelters, homeless shelters, as well as any emergency housing that can be provided by the Federal Emergency Management Agency. We also have those who may be living in hotels and motels due to lack of adequate alternatives, and that's regardless of who is paying for the room, whether it's the family or an organization that may be covering that cost. As you can see here, the federal definition of homelessness also includes individuals and families who may be staying with others, such as families who are doubled up due to loss of housing, economic hardship, or any other similar reason. And just to kind of give an example to make that more visual, let's say that Susie's family is experiencing an economic hardship. And due to that, they had to move in with a relative, let's say Mary's family. And Susie and her family, however, are not listed on the lease of that home. And because of that, they can be asked to leave at any given time without any legal recourse. And due to that, they would qualify under the McKinney-Vento Assistance Act and federal definition of homelessness. And the McKinney-Vento Homeless Assistance Act is a federal law that is designed to ensure that our homeless children and youth have the same access as other children to public education, including public preschool programs. So as you can see on this slide here, other rights that our students have under the McKinney-Vento Act include staying in their school of origin, receiving free school meals, getting help with school supplies and other needs, immediate school enrollment, and being connected to early childhood services.
And we would like to humbly request, if you are not the main speaker, if you can put yourself on mute. Thank you.
Thank you, Brenda Lee. And as you can see, there are many rights and protections for our McKinney-Vento students at a federal level. And here at the Chula Vista Elementary School District, we are doing our best in regards to implementation and identifying our McKinney-Vento families. As Letty mentioned earlier, even at the state level, we have seen a decline in numbers for our McKinney-Vento population, but that doesn't mean that there has been an actual reduction, and that decline is more attributed to our families not being identified. Okay. So one of the goals of our district social work program is to provide McKinney-Vento students with necessary services to succeed academically. Some of the services our team and district may provide include assistance to connecting students to transportation and tutoring if needed, mental health services, and that can look like trauma-focused school-based counseling, priority enrollment in our before and after school programs such as Stretch and Dash, also case management and advocacy, both at the school level and beyond. So at the school level, we may attend SST meetings, IEPs, parent conferences, and that's really to best support our students and ensure that they're receiving the best supports that are available to them to kind of set them up for success. Beyond school, we may also work on referring families to the Resource Center or other organizations based on the student and family's needs. And our hope is really to be collaborative with our community partners in order to provide, again, our families with the
Tanya, I think you're muted.
Can you hear me?
Yes, ma'am.
Okay. Where did you last hear me?
Move on. You can just tell us more about the services that you include.
Okay. So I'm not sure where I cut off, but some of the services that we do have for our students are connecting them to transportation and tutoring if that's something that they need, mental health services, that can be school-based counseling, priority enrollment in our before and after school programs such as Stretch and Dash, case management, both at the school level and beyond. And our hope is really to be collaborative with our community partners in order to provide our families with the best supports possible. And with that, I'd really like to say and invite all of our community partners that if you are working with a family or student that you think may qualify, please go ahead and refer them, and we can do an assessment on our end, again, to provide those students that fall under the McKinney-Vento Assistance Act with everything that they need to succeed. And with that, if we can go just to the last slide, there is my contact information, and I would also like to open it up if anybody has any questions and if we have time for that. Thank you.
Thank you, Letty. Thank you, Tanya, for the info. It's good to know and reinforce our knowledge and correct knowledge about the expanded federal definition of homelessness. And here in the chat, we're getting immediately a feedback in terms of free healthcare to homeless for those without insurance. And that comes from Maria Miramontes, whom you heard from earlier in the call. For questions on this and anything related to the CVESD support services, you can contact Tanya and Letty, and the information is via email and phone number on your screen. Thank you, ladies.
Thank you, Brenda Lee.
And with that, this is our last speaker set for our lineup today. It took us a little bit more. Thank you for hanging in there for this extra 10 minutes. I think the information and the feedback that we heard from each other on the collaborative, on each other's programs is important. And make sure that you type in the chat if you haven't done so yet, your contact info and offers or requests from other speakers. From our slides, the only one left is regarding the speaking schedule for next year. We have this December 14 one, where we anticipate that being very short. We will be very busy with our, actually in the middle of the Adopt a Family and Santa Shop, next slide, items from that week from December 13th to the 18th. So that week will be very busy. But we will be seeking speakers for incoming calls for the 2022 schedule. This is posted in our website, www.chulavistacc.org. And we really thank all the sponsors and partners who are joining us and will continue to provide support in the next year. Thank you so much for attending. And our next call is December the 14th. So that's a correction that I need to make there, December 14th. Thank you so much, and have a wonderful rest of your day.